Our special focus on India decides the reality of the national shame the Prime Minister referred to over a year ago. India has once again topped a UN survey, but the dubious distinction is that we account for the highest number of deaths of children under 5 in the world. This is not just because of absolute numbers. For instance, China does much better than us, given their deaths are much lower than ours. Also, our neighbouring country and economically much poorer Bangladesh has less number of deaths per 1,000 children than we do. The reality, as I said, is one we report every day. Just today, 6 more children died in Uttar Pradesh's Gorakhpur district of encephalitis, a disease that visits every year.
Five-month-old Aman, who had high fever and convulsions, died of cardiac arrest hours after he was admitted to hospital. 3-year-old Krishna, one of the 1,700 patients battling acute encephalitis at the Gorakhpur district hospital. 4-year-old Nandini lost consciousness 2 days ago. It's her 8th day at this encephalitis ICU ward.
Every year, the state government makes several promises for creating better infrastructure to fight encephalitis. But in these wards, hundreds die and thousands continue to fight a losing battle with this deadly disease.
A 3,350 crore national encephalitis program has changed nothing in Gorakhpur. Over 500 children died last year. Perhaps the reason why India has the highest child mortality in the world, according to the latest United Nations survey. A UNICEF report says India had the largest number of children dying under 5 in 2011. 15.5 lakh children under 5 died in India last year, worse than Nigeria, Congo and Pakistan put together. Though in absolute terms, there were 71,000 less child deaths from 2010 to 2011, and the rate of mortality has slowed down.
It is so in terms of numbers of children who have died in the age group under 5. Because we have a very large population of children in that age group.
Experts point out India is still fighting deadly diseases like malaria, pneumonia and diarrhea, which are mainly caused by malnutrition.
There are 8 states which needs immediate attention: Uttar Pradesh, Bihar, Jharkhand, Chhattisgarh, Madhya Pradesh, Odisha, Assam, Rajasthan. So these states, if we target, actually we can at least, because these contribute to around 70% of the under 5 mortality for India.
There were plans to invest 3% of the GDP in health, but it still hovers around the 1% mark, compared to China's 4%. With Anand Zanane in Lucknow and Tanima Bishwas in Delhi, Alok Pandey, NDTV.
A national emergency we must focus on even at the time of politics and diesel price hikes. And joining me for more on this tonight is Dr. Binayak Sen, someone who's worked tirelessly with young children in Chhattisgarh, who's written books on this, but sadly shot to the headlines when he had sedition charges filed against him and was accused of being a pro-Naxal sympathizer. Dr. Binayak Sen, what happened with you personally in some sense reflects how the real issues are swept under the carpet of children's health. And really in Chhattisgarh, where you work, in other areas in Jharkhand, you made the point how it's children of SC/ST children who actually are the highest numbers amongst these grim statistics.
Yeah, the issue is mainly one of nutrition, very basic features like nutrition, public health, availability of medical care at the right time, and the phenomenon of malnourished mothers makes this a self-perpetuating reality. So we are really in a situation where the government needs to be seen as addressing these problems with much greater commitment, and that is something that is not happening. The 12th 5-year plan, the plans that were made by the high-level expert group have been more or less shelved, and those are not going to be, from all indications, those are not going to be part of the reality of the 12th 5-year plan. And in this situation, half our children, half of all deaths that take place below the age of 5 years are associated with malnutrition. This is what the National Institute of Nutrition tells us.
In fact, Dr. Sen, you made that point about making this a political priority. Just over a year ago, the Prime Minister called this a national shame. We also had Gujarat Chief Minister Narendra Modi, when asked about this, making this bizarre statement about how it's because girls are figure conscious that their malnutrition levels are high. Why do you think this is not a political priority? We've seen the political outrage over a diesel price hike, over LPG cylinders being capped. Why is this not a subject of political and national outrage?
This is not a political priority because the people who are suffering don't have the government has institutionalized inequity in the whole globalization, privatization, liberalization strategy, has institutionalized inequity to a point where the voices of the poor are no longer heard in the corridors of power. And now and this is what has happened with the public health, with the 12th five-year, with the issue of healthcare in the 12th five-year plan, with the whole increase in the GDP that was promised earlier, that is no longer being available for the universalization of healthcare. So we really need.
Yes. That point you made in universal.
So we really need to address the problems of nutrition and infectious diseases. These are the two major problems which are perpetuating the high death rates, high morbidity and high mortality among under 5 children, including among neonates. Half of the infant mortality is because of the high deaths in the first month of life. And unless these problems are tackled, unless we have better facilities at the public health, unless we have human resources that match the resources that are available, these issues are not going to change.
You made that point, sir, but yet you would have governments argue, and this would be whether it's the central or the state government, that the spending on welfare schemes in India is higher than ever before. They would tout examples of Manrega in Chhattisgarh and Madhya Pradesh, and Orissa, you would have the cheap rice schemes. The argument would be that India is spending much more on welfare schemes. You've got so many ambitious schemes for children on paper. You've got the ICDS, you've got the National Rural Health Mission, you've got various schemes on paper. The public spending on it is huge. Why is there no impact of this being felt on the ground?
Well, I'm afraid the proof of the pudding is in the eating, the fact is that we have a high level of malnutrition among children. That is the Nandi Foundation report, which Prime Minister Manmohan Singh himself released and said it was a national shame, which you referred to, which you yourself referred to, and that national shame leads to high levels of mortality among children. And the facilities available to women for safe delivery are also simply not adequate, and a large proportion of the deaths in the neonatal period are because of the non-availability of adequate obstetric care facilities.
In fact, if you're just watching,
all in all, we have a very big challenge on our hands. Malaria is a major problem.
You made that point about malaria. I was just going to say exactly that malaria is a disease that kills so many young children. It's one of the main killers and seems to be something which could be so easily prevented with the availability of medicine. The contrast, of course, is more stark when you look at our neighboring country of Bangladesh, where we've seen there's been a remarkable improvement in the child-infant mortality rates there. Why can Bangladesh do it and not India?
I'm afraid I can't hear. I'm sorry.
Sorry, I was asking about why our neighboring country like Bangladesh, economically much behind us, how have they managed to improve their statistics so remarkably? Why can Bangladesh do it and not India?
Well, all the South Asian countries other than India are doing better than India. So it's not, I don't think there's anything wrong with our South Asian identity. I think the problem is that the government is not able to focus sufficiently on the issue of bringing these issues forward. And unless the government shows much greater commitment to the issues of better care for mothers and better care for children, better nutrition overall, these conditions are not going to change.
Dr. Binayak Sen, thank you so much for joining us. Someone who's worked tirelessly for children's welfare and fighting, and someone who faces sedition charges. The irony of India today. Thank you so much, Dr. Binayak Sen, for joining us tonight.
India's #1 news app just got even better. Download NDTV's new app. Fully optimized for retina display. Full screen view. Faster response time. And Sudoku. NDTV's new iPad app. Download now.